Question. A 35-year-old female presents with symmetrical joint pain, morning stiffness lasting more than 30 minutes, and swelling in her wrists and knees. Laboratory tests show elevated erythrocyte sedimentation rate, ESR, and C-reactive protein, CRP. What is the most likely diagnosis? A. Osteoarthritis. B. Rheumatoid arthritis. C. Systemic lupus erythematosus, SLE. D. Gout. Answer. B. Rheumatoid arthritis. Explanation. Rheumatoid arthritis is characterized by symmetrical joint involvement, morning stiffness lasting more than 30 minutes, and elevated inflammatory markers, ESR and CRP. It commonly affects the wrists and knees. Osteoarthritis is typically asymmetric and lacks systemic inflammation. SLE primarily affects multiple organ systems, and gout presents with recurrent acute attacks of joint inflammation. Question. A 50-year-old male with a history of chronic low back pain presents with early morning stiffness that improves with activity. He also complains of reduced spinal flexibility and pain in the sacroiliac joints. What is the most likely diagnosis? A. Osteoarthritis. B. Ankylosing spondylitis. C. Herniated disc. D. Fibromyalgia. Answer. B. Ankylosing spondylitis. Explanation. Ankylosing spondylitis is a chronic inflammatory condition primarily affecting the spine and sacroiliac joints. It presents with early morning stiffness that improves with activity and can lead to reduced spinal flexibility. Osteoarthritis primarily affects weight-bearing joints. Herniated discs cause radicular pain, and fibromyalgia is characterized by widespread pain and tender points. Question. A 65-year-old woman falls and sustains a hip fracture. On examination, her affected leg appears shorter and externally rotated, and there is tenderness in the groin area. What type of hip fracture is most likely? A. Intertrochanteric fracture. B. Subtrochanteric fracture. C. Femoral neck fracture. D. Acetabular fracture. Answer. C. Femoral neck fracture. Explanation. A femoral neck fracture typically presents with a shortened, externally rotated leg and tenderness in the groin area. Intertrochanteric and subtrochanteric fractures are associated with different deformities, and acetabular fractures involve the hip socket rather than the femur. Question. A 30-year-old athlete complains of pain in the lateral aspect of the elbow, aggravated by gripping and lifting objects. On examination, there is tenderness over the lateral epicondyle of the humerus. What is the most likely diagnosis? A. Medial epicondylitis, golfer's elbow. B. Radial head subluxation, nursemaid's elbow. C. Cubital tunnel syndrome. D. Lateral epicondylitis, tennis elbow. Answer. D. Lateral epicondylitis, tennis elbow. Explanation. Lateral epicondylitis, or tennis elbow, is characterized by pain and tenderness over the lateral epicondyle of the humerus. It is often associated with gripping and lifting activities. Medial epicondylitis, golfer's elbow, presents with pain on the medial side, while radial head subluxation and cubital tunnel syndrome have different clinical features. Question. A 40-year-old male presents with a painful, swollen knee that is warm to the touch. He recently had a respiratory infection. On examination, there is an effusion in the knee joint, and laboratory tests show an elevated white blood cell count in the synovial fluid. What is the most likely diagnosis? A. Osteoarthritis. B. Gout. C. Septic arthritis. D. Rheumatoid arthritis. Answer. C. Septic arthritis. Explanation. Septic arthritis is characterized by a painful, swollen, and warm joint with an effusion. It often occurs secondary to an infection, and synovial fluid analysis reveals an elevated white blood cell count. Gout presents with acute attacks of joint inflammation and the presence of urate crystals. Osteoarthritis and rheumatoid arthritis have different clinical presentations and synovial fluid findings. Question. A 55-year-old man presents with recurrent episodes of sudden onset, excruciating pain and swelling in his big toe. On examination, the affected joint is red and warm to the touch. Serum uric acid levels are elevated. What is the most likely diagnosis? A. Osteoarthritis. B. Rheumatoid arthritis. C. Ankylosing spondylitis. D. Gout. Answer: D. Gout. Explanation: gout is characterized by recurrent acute attacks of joint inflammation, commonly affecting the big toe, podagra. It presents with sudden onset pain, swelling, redness, and warmth in the affected joint. Elevated serum uric acid levels are often present. Osteoarthritis and rheumatoid arthritis have different clinical presentations, and ankylosing spondylitis primarily affects the spine and sacroiliac joints. Question: a 45-year-old woman presents with symmetric joint pain, morning stiffness, and visible small nodules over her elbows. Laboratory tests show positive rheumatoid factor and anti-cyclic citrullonated peptide, anti-CCP, antibodies. What is the most likely diagnosis? A. Osteoarthritis. B. Psoriatic arthritis. C. Rheumatoid arthritis. D. Systemic lupus erythematosus, SLE. Answer: C. Rheumatoid arthritis. Explanation: rheumatoid arthritis is characterized by symmetric joint involvement, morning stiffness, and the presence of rheumatoid factor and anti-CCP antibodies. Psoriatic arthritis is associated with psoriasis and can present with dactylitis, sausage fingers, toes. SLE has a different set of clinical manifestations. Question: a 60-year-old woman complains of hip pain and difficulty walking. On physical examination, there is pain with hip flexion, internal rotation, and adduction. Radiographs show joint space narrowing and osteophyte formation. What is the most likely diagnosis? A. Femoral neck fracture. B. Hip dislocation. C. Osteoarthritis of the hip. D. Avascular necrosis of the femoral head. Answer: C. Osteoarthritis of the hip. Explanation: osteoarthritis of the hip is characterized by joint space narrowing, osteophyte formation, and pain with specific hip movements. Femoral neck fracture presents with acute pain and deformity. Hip dislocation is usually traumatic. Avascular necrosis of the femoral head typically affects younger individuals and has a different clinical presentation. Question: a 25-year-old male presents with anterior knee pain that worsens with activities such as climbing stairs and running. On examination, there is tenderness over the patellar tendon insertion on the tibia. What is the most likely diagnosis? A. Osgood-Schlatter disease. B. Meniscal tear. C. Patellofemoral pain syndrome. D. Anterior cruciate ligament, ACL, tear. Answer: A. Osgood-Schlatter disease. Explanation: Osgood-Schlatter disease is characterized by anterior knee pain and tenderness over the tibial tubercle, commonly seen in young athletes. Patellofemoral pain syndrome is characterized by anterior knee pain that worsens with activities. Meniscal tears and ACL tears have different clinical presentations. Question: a 40-year-old male presents with pain and stiffness in his shoulder, which is worse in the morning and limits his ability to raise his arm. On examination, there is limited active and passive shoulder abduction and external rotation. What is the most likely diagnosis? A. Rotator cuff tear. B. Frozen shoulder, adhesive capsulitis. C. Dislocated shoulder. D. Labral tear. Answer: B. Frozen shoulder, adhesive capsulitis. Explanation: frozen shoulder, or adhesive capsulitis, is characterized by pain and stiffness in the shoulder, limiting range of motion, particularly abduction and external rotation. Rotator cuff tears typically present with weakness, and dislocated shoulder and labral tears have different clinical features.